All right, everyone. So welcome to the How to Care for Yourself and Your Loved One with Head and Neck Cancer webinar. This is presented by the Head and Neck Cancer Alliance and the American Head and Neck Society. I'm Michelle Chen. I'm an assistant professor of otolaryngology, head and neck surgery at Stanford University. And I want to thank our panelists for joining us today to share feedback and answer questions from our webinar audience. So I'd like to start off just by introducing each of our three panel members. And we have three amazing ambassador caregiver panelists. To start off with, we have Sue Lim. She's an oncology nurse and caregiver to her late husband, Carl, who was diagnosed with lymphoepithelial-like carcinoma of the parotid gland. And she's coming to us from Seattle, Washington. And then we have Allison Brieninger. She's a caregiver to her husband, Chen, a Fanconi Anemia, tongue, bladder, and throat cancer survivor. She is a writer, speaker, and caregiver who is an advocate and creator of the Negative Space and is located in St. Paul, Minnesota. And lastly, we have Dr. Andi Steinhoff. She cared for her mother, Bonnie, who was diagnosed in 2008 with stage 3 tonsil cancer, resulting in a partial neck dissection, radiation, and many late effect symptoms. She currently is a nurse navigator for the Head and Neck Cancer Alliance and assists and guides patients and caregivers with their journeys. Dr. Steinhoff earned her PhD in nursing with a focus on head and neck cancer survivorship. So why don't we kick it off? And Sue, would you like to start off?
Sure. Thanks for having me here. My name again is Sue, and I was a caregiver for my beloved late husband, Carl. We were married at the time of his death for 25 and a half years. When he was first diagnosed, he was only 45. He was a never smoker. He only occasionally drank, and he didn't have any health issues. But it all started with a hard lump on his neck. And we went immediately to his primary care physician, and he put him on a bunch of antibiotics and really was resistant to having it biopsied because this is a healthy 45-year-old. And so we then self-referred to an ENT, and unfortunately the excisional biopsy turned out to be stage 4, that rare salivary gland cancer, that lymphoepithelial-like carcinoma of the parotid gland. It's a mouthful. I never heard of salivary gland cancers. So Carl initially underwent an 11-hour parotidectomy and total neck dissection with a flap reconstruction. And then 6 weeks later, he did chemoradiation. But unfortunately, 5 months later, he was having a dull ache on his side, and come to find out that the cancer not only returned, but it had spread to his rib. So he then enrolled into his first clinical trial, and it was with a checkpoint inhibitor and an oral agent. And he did actually really well on it, stayed the full 2 years, and then was on maintenance therapy for an additional year on that checkpoint inhibitor. But we found on imaging that, unfortunately, again, the checkpoint inhibitor was no longer controlling Carl's cancer, and multiple lesions were growing larger. So he then enrolled in another clinical trial, and it was TIL, the tumor infiltrating lymphocyte therapy, and a really aggressive treatment. But despite that, Carl only had a partial response, and ultimately his disease took his life, and he passed March 2nd, 2021. So I do hope that, my story might touch those of you out there who are caregiving for your person, and that maybe some of what I share may resonate with you. Thanks.
Thank
Hi,
you.
I'm Alice. Yes. Thanks, Sue. I'm Allison Brieninger. I'm a caregiver for my husband, Sean. He was diagnosed around 12 or 13 years ago with a rare genetic disease called Fanconi Anemia, and that causes bone marrow failure and also cancer, especially of the head and neck, at a rate of around 700 times that of the rest of us. And so in that time, he's had a bone marrow transplant and all the complications that came with that. And then a few years later was diagnosed with tongue cancer and had to have half of his tongue removed and also all of the lymph nodes removed on that side. And then they used a flap from his arm to repair his tongue. And then after that had bladder cancer and had his bladder and prostate removed. And then since then has also had throat cancer twice, one of which was operable. The other time was not operable. And so he went through radiation and some chemo. Has had some gum cancers and has had about 150 skin cancers. So we know with this disease, because it's a DNA breakage syndrome, that the cancers are going to continue happening. And so at this point, he gets scoped and scanned and checked all the time so that we can find the cancers when they're very small and remove them as quickly as possible. Through that time as his caregiver, I have no medical background. And so I was just thrust into this role in my early 30s. And I just really saw that he was getting lots of support and care. And then I, as his caregiver, even though I was going through all of these things, I've been at all of it by his side through all of these appointments and procedures and hospitalizations, that there was not support or acknowledgement for all that I was going through. And so he and I started a nonprofit called The Negative Space, which is based on the artistic concept of kind of what's in the background of the picture. What we do there is provide direct support to caregivers. So we do one-on-one coaching, virtual support groups. We have a podcast called In Sickness with caregiver gift boxes. But then also we're trying to really make systemic change. And so really trying to educate the medical professionals, but also community members about what it is that it's really like to be a caregiver. And so I'm grateful to have this opportunity today to share a little bit about what it is to be a caregiver in my story. So thanks for having me.
And I'm Andi Steinhoff, and I'm a caregiver for my mom, who stage 3 tonsillar cancer diagnosis back in 2008. Very happy to report she's here, and dealing with a lot of side effects from treatment, as most head and neck cancer survivor folks do. When she was diagnosed in 2008, she had been reporting her symptoms really diligently, and the diagnosis was missed for about a year. So we ended up self-referring to another institution outside of our area, where she was treated. She had a partial neck dissection and then 6 weeks of radiation therapy. We've been very fortunate to have good follow-up care, and she's very good about reporting any kind of odd or suspicious symptoms so that we can follow up. And it's been quite a journey, as it is for all caregivers and these patients. I've learned an awful lot, and this was prior to my going to nursing school, so I really did not have much of a medical background at all going into this. And boy, you sure learn a lot really fast. So I'm so grateful to be here. I'm grateful to be here talking about my mom, who's going to turn 85 next month. So it's an honor and a privilege to care for these patients, but also to help other caregivers who are in the process. It's quite a journey. So I'm very pleased to be here. Thank you.
Thank you, Dr. Steinhoff. Great. So I think I would just want to kick it off with sort of asking our panelists, what were some of the caregiver needs that you experienced during the initial diagnosis of head and neck cancer? And if you have any advice on some of the coping strategies that you found were helpful for you at that time.
I could start. When Carl received his diagnosis, we were in complete shock. And as a background, I'm an oncology nurse, and I had, again, never heard of salivary gland cancer. Of all cancers, it just seemed out of the blue. And the ENT surgeon who came in with the pathology results from that excisional biopsy, he actually came in holding a journal article of the rarity of Carl's cancer. And we knew, seeing this article, that this was not a good sign at all. So we gave ourselves permission that weekend. We saw the ENT, and then we were kind of like shell-shocked, but we gave ourselves permission for the weekend to really just grieve by ourselves and feel sad about the diagnosis. But then when the weekend was over, we were in fight mode. We knew this was extremely aggressive, and we need to make some decisions very quickly. And so we leaned pretty heavily on our family and friends to help us network for ENT professionals. And we actually did meet with a surgeon in the Portland area just so that we could hear his recommendations. And because not only were we processing through the devastating stage 4 diagnosis, but also we found out that Carl's tumor in the parotid gland was encasing the facial nerve. And so severing the facial nerve would mean partial facial paralysis and impacting Carl's quality of life. So then during that 11-hour surgery, thankfully I had my sister and one of my brothers with me during that time, because I just could not do this alone. I knew that.
You can go next. When my husband got the diagnosis of the tongue cancer, we had gone through so much already. We had already been through a bone marrow transplant and all these things. And we were sort of like, here's another thing that's going to happen. But we started to realize it was different when person after person was coming into the room with, like, here comes the physical therapist, here comes the occupational therapist, here comes the speech there and the swallow, and there were binders and pictures of what his arm was going to look like. And I started to realize, like, this is different. This is bigger. And so a few of the coping things that I did, one is that I took a leave of absence from the job that I had at that time. I just sort of knew, seeing all those binders and hearing, like, he's going to have to relearn how to talk and swallow, that this was a big deal. And I couldn't pretend to continue on like as normal. And so I took a leave of absence. I was fortunate to be able to do that. And the other thing is I called in help. So I called in family members and said, look, for the first however many weeks, we're really going to need help, because so many things, and that I'm sure we'll talk about today, is that makes it harder with head and neck, is that eating, swallowing, talking is something that is impacted. And so all of his food and nutrition and medication had to go through a feeding tube for a while. And so we had like charts and graphs and times and all of this. And so it just felt like I can't do this by myself. So sort of like you just said, Sue. And so those were two ways that I coped. One was taking that leave preemptively, and then calling in help and saying, for the next few weeks, I can't do this by myself. I need someone to be here with me.
I think I would echo, everybody's comments about, when we got the diagnosis, the biopsy results being malignant, we were in shock. And I think one of the things that I really felt that I needed at that time was information. And I needed good information and non-biased information. And I had the good fortune of having a previous career as a librarian. And so I immediately, dug into the literature, not knowing what I was really looking for or looking at, but just trying to find information that was valid and applicable for our situation. and also trying to find information about treatment centers that, particularly specialized in this type of cancer. And so for me, I felt like information was so valuable and empowering, because you feel so helpless at this time. You get this diagnosis, you're gobsmacked, and you think, what do I do? So I think empowering people to be able to make decisions that are best for them is critical. And so I know for me, that information was just so critical and so helpful and empowering. And then relying on, as our other folks have said, asking for help, knowing that we're going to war. It's what we're doing. And so we need all hands on deck that we can get. So, it is quite a battle. So that's an understatement.
For sure. Yeah, I think you guys touched on some really important things, like taking time and space for yourself and your loved one, really asking for help and calling in reinforcements and getting more information, whether it's doing research on your own, seeking second opinions, going to other treatment centers. And I think those are really valuable for our audience. And so, as we've touched on a little bit, it's a long battle, right? And so it goes from the initial diagnosis through survivorship and recurrence, and possibly end of life as well. And so how do these needs and strategies change during survivorship for you guys?
I think that initially, it was all those acute needs, right? I mean, I think I just pictured like the pain med chart that we had at the beginning, right? And then as you go on, like that dwindles. And so in the beginning, it's very much just the coping strategy is just sort of like get through the day and do what you need to do and write the thing that's right in front of you. It's a lot more of those acute needs. And then I think as it goes on, I think it was Andi who was telling us this before we logged on today. It was about, these late term effects, like you don't always think about. And so just recently my husband's all of this was swollen, and someone said, oh, it's the parotid is blocked and from radiation that he had 8 years ago, right? And so I think it's those things that it goes from sort of the acute to more of the scans, the exercises, the PT, the sort of keeping on top of things and not becoming complacent and just thinking like, oh, that's in the past, but always sort of being kind of on top of it and watching for both new recurrences, but also things like, all of those radiation effects that unfortunately continue on years after.
I think too, the initial shock and, you're in battle mode, and at some point it's difficult kind of to, I think, determine phases. You have anger, you have grief, you have all the stages that you go through. Why is this happening? Why, but you're in the midst of the mix of caregiving at the same time, making sure, the feeding tube isn't clogged, and, is there an infection going on? And oh my God, the nasogastric tube came undone, and we got to go to the ER, and there's nausea, and what do we do about that? And, X, Y, and Z. Then depending upon, do you get kind of a little bit of a reprieve? Do you get some time where you're not in active treatment, the tube's been removed, you're starting to approach a quote unquote new normal, and then perhaps you're hit maybe with recurrence, or maybe you're hit with another diagnosis of an additional comorbidity. So it's much, to me, like a roller coaster. But the phases, they blur together sometimes. They're not distinctive, but I think there are different phases that you go through. And it's a never-ending, it's just a never-ending cycle. I mean, even now, this far out from where we're at treatment-wise, dealing with side effects, dealing with, has the cancer come back? When do we need to go for imaging? When can we wait? What can we put off? What should we not put off? It's very, it's exhausting frankly. But it's also a gift. It's a gift to be exhausted. So, it's a balance of both, really. So I don't know quite how to answer the question because it kind of depends on what phase we're in when. And it changes and shifts when I least expect it. And I'm sure when she least expects it too.
Yeah, I think that's a great point. I think, it sounds like what you said about it, sort of it being sort of never ending. I think, that's one thing that, caregiving, there's not an end date to caregiving. It sort of continues and, it goes up and down. But like Allison was saying, because there's a lot of late side effects of treatment and also always the risk of recurrence, you're constantly sort of having to stay on top of things, and it can, everything, the sort of what you have to do on a daily basis can fluctuate, but you're always thinking about it, and you're always a caregiver actually, and it never ends. So, and then I think I wanted to sort of ask Sue, because of your unique situation, how do you approach sort of end of life care as a caregiver? And, especially like, how do you take time for yourself, and, how do you address your needs during that difficult time?
A lot of what I've learned is in hindsight, to be honest, because like what Allison and Andi have shared, it is a roller coaster. You're in the thick of it. You've got your blinders on and just trying to survive. You're in survival mode. So I'll take a step back. I think, as an oncology nurse, not as a caregiver of someone dying, but I think it's natural for anyone facing something life-threatening, a disease, illness. But in my opinion, I think providers don't have these really honest conversations with their patients about end of life because they're so focused on treatment. There's a goal, you gotta treat. And it's uncomfortable. Our culture does not want to talk about death. And in some cultures, talking about death brings on death. That's the thinking. Okay. So for Carl, I let him take the lead. If he brought it up, I would make sure that I would just listen and not try to change the subject. Because I think the early on, very early on, I would just say, don't talk like that. It's gonna, you got this treatment to focus on. But in his heart, he wanted to talk about it. And I'm glad he did. Because of that, I was able to talk about what his wishes were. And because there was a point that he no longer could make his own decisions and it would fall on me. So I was really thankful that we were just honest with one another, and we knew that it was okay for him to talk about his death because that's what he needed. And he needed to hear that I would always be there for him, no matter what.
Yeah, sure. I just also want to pause and just to the webinar audience, if anyone has any questions, feel free to put them in the chat or in the Q&A. And so I think this is a good sort of segue to our next question, that, as caregivers, you guys tend to put everyone and everything in your life before your own needs. And it can be really exhausting. So I guess just in general, like, why do you think that is? Like, why do we put all our needs, everyone else's needs sort of ahead of our own when we're caregivers?
I think for me, Carl was my best friend my soulmate, my partner, and I would do anything that I could to save him. Okay, that's how my perspective. And there's an analogy, you know, when you're on a plane and they say, put on your oxygen mask, your own oxygen mask before you put on someone else's or a child, right? But it's so easy to just say that and so hard to do because, again, in the survival mode, when you're watching someone you love so dearly suffering, I mean, suffering with these horrible side effects. And then in Carl's case, especially towards the end, his pain was progressing so quickly. And to be witness to that was so hard, okay, that I think that's why the focus just had to be on him. It had to be on him. And I'll give you an example. I think early on, when he was going through the chemo radiation, had his PEG tube, right? Couldn't eat, and we were foodies. Okay, we loved to eat. Okay, so I was coming home from work one day, getting off the bus, and I was stuffing my face as quickly as I could, eating the sandwich. And then my gardener saw me in front of my house and said, "What the heck are you doing?" And I said, you know, I feel so guilty eating in front of someone who can't eat. And I just didn't want, I was secret eating. Okay. So that he wouldn't have to see me or smell the food, you know, something that he just couldn't have. So it's a little my experience.
I just have to say, Sue, thank you so much for all the sharing that you're doing today. I appreciate it. I would say that, and yes, in the work that I do at my nonprofit with caregivers, that this is a big part of it, is helping these caregivers claim this title, right? And helping them realize it's okay for us to say, I'm part of the story too. This is impacting my life. Like the story you just told us, Sue, I mean, your life was impacted, right? Down to what you ate and when you ate it. And so I think that caregivers often feel like we're not sick, therefore we don't get to say that this is hard because we're not the ones who are in pain or in treatment or in, you know, radiation or those things. I think that our culture is one of toxic positivity and bright siding. And so I think that sometimes people do say, this feels really hard. And then they get, in return, someone comes back at them and says, well, at least, you know, and so then they learn it's actually not really maybe safe for them to say the hard things out loud. And so I think that we just feel like we're a secondary or like don't even count as part of the story. And we just like only feel like it's okay to put time and energy into our person and not acknowledge the impact that all of it's having on us.
I think too, our society, you know, at least previously has been kind of, you know, women are acculturated to be caregivers and to sacrifice without, you know, that's just what you do. You're taught from an early age as a little girl. It's your job. I mean, that's you see it from the older women in the family, usually. It's not always that way, but and so it's very hard to break those patterns when you're in a caregiving situation as an adult. And especially if you grew up around sick family, which I did. So I always saw women caregiving. It just was natural. I didn't even think anything of it. And not saying anything about it, but, you know, that's just what you do. So I think it takes a concerted effort to stop and ask yourself as a caregiver, okay, so what do I need to keep myself fueled to keep being able to do this and not feel guilty about it, which is a big step. And even sometimes it's really hard because the one that you're caring for is like, well, why did you spend another hour at the bookstore when, where were you or whatever? Well, I needed that extra hour just to decompress and just to walk the aisles and stare, it just gave me a mental break that I really needed. And I think, that's probably another part of one of the questions, but the intellectual toll, emotional toll, it's not just a physical part of it, but it's so draining because you're always thinking about it. It's always on your mind. So I just think it's very hard for us, especially females, to step back from that and look at, okay, do I need help? What do I need to do to refuel myself? Those aren't questions we're taught to ask early on. That's considered being selfish. And that's hard. That's hard to, I'll claim that selfishness. If I can be a better caregiver and be healthy myself, just like Sue was saying, I can't put your mask on. I can't put yours on if I don't do mine. If I'm not able to breathe, I can't help you. And that's hard to admit because that's kind of being quote unquote selfish.
Yeah, it's a really good point. It's really hard to advocate, I think, for your caregiving needs, especially when you're caregiving for someone who is also, going through a lot and someone you do love so dearly. So I think, one thing that Dr. Steinhoff touched on that I think would be helpful to expand further is, we talked about how caregiving has a lot of impact on caregivers' own physical, mental, and emotional health. And so I think it'll be helpful to discuss sort of how your role as a caregiver has impacted these three aspects of your own health.
I can go, I think, in every way, right? I mean, so I'm 12 or 13 years into this. I sometimes feel like I have a chronic illness, even though I don't, just because I feel like I have gone through so much that I feel kind of like beat down and tired in ways that I think other people my age are not. I've had to do, someone asked us privately about therapy, and I absolutely, like, I have a therapist and my husband has a therapist and our child has a therapist. And I think, all of the support. And I think something that is tricky is that with our nervous systems, like, we as caregivers are in fight or flight so much that sometimes when we have a quiet season, that's when all of a sudden the feelings are like, oh, fantastic, now I can be felt. And so sometimes those quiet seasons emotionally feel harder because those are the times that the feelings that didn't have a chance to be processed in the middle of the emergencies come out. And so I have had to work really hard and intentionally, and I'm still working every day on noticing the feelings, processing the feelings, working on them. And because I ignored them for too long, and they just, you can't stuff them down. They're going to come out at some point. And so, so I'm all about the therapy and any of the other things that we can do to be, the statistics are pretty terrible about the impact that caregiving has on our physical bodies. And so I think that there's any ways that we can take extra care of ourselves, to knowing how much kind of we're being beat down on a daily basis and that our nervous systems are working so hard is important.
Echo Allison. As a caregiver, you are just so emotionally and physically and spiritually so drained. I mean, there's like, you're like bottom of their bucket, right? Scraping. It's just so tired. And I remember as an oncology nurse, because I was working full time and always felt that I had to be on for my patients. But then when I came home, I couldn't just like decompress, unwind, get into elastic pants or something, right? But I've always felt like I had to also be on for Carl, because especially towards the end, in the last 5 months, where things really accelerated very quickly. And for me, I do think I had some PTSD from those last 5 months because it was so acute, and going to the ER 3 times and ambulance and all that, and it did take its toll. But again, a lot of that chronic stress was, I realized it in hindsight after the fact. You know, when you do have that quiet moment of just breathing and just realizing what has all gone on, and what I was involved in was just so much. Yeah.
Yeah, I would just echo the same thing. I think on every level, learning very quickly about the importance of just getting back to basics, like sleep is important, eating decent food is important. You know, the things that you're like, you know, so I'm just gonna chug down this whatever really fast, or I need to go through a drive-through because I got to get home. I've got to make sure that, you know, she gets nutrition on time, and I've got to pick up scripts, and I've got to pick up, you know, or we have this side effect going on. Are we headed to the ER again? You know, Sue was saying, what's going to hit us tonight? And I can't eat in front of her because she can't eat anything, and I can't do that. I mean, I feel badly. What strategies do I need to be putting in place? You're always thinking about, you know, kind of what's the next shoe that's going to drop, and how do I need to be prepared for that? And what do I need to be looking out for? Because, you know, you're there to serve and protect and, you know, make sure that they survive as best as you can. But we don't then you look at yourself in the mirror and you're like, my God, who is that person who, you know, really needs to sleep and is not eating properly and probably needs some therapy, and et cetera, et cetera. So I think on every level, whatever that takes, you know, I can't say for each caregiver. Some folks really benefit from therapy, other people don't. Some people do well in a support group, some people not so much. So it's really identifying for yourself, what do I need to be at the best health that I can be, physically, spiritually, mentally, and then lining up whatever that is. And that could be having a friend come in and sit, you know, with your person while you go and walk or do whatever, just taking a break. But it is hard. It's hard to identify. I think one day I looked in the mirror and I thought, my God, I think I've aged. It looks like I've aged 20 years in a matter of months. What am I doing? You know, this is not good. So then kind of sitting down and thinking about, okay, I'm going to, even in spite of guilt, I'm going to carve out this time for myself. And even if it was taking myself out to eat, and enjoying it instead of feeling guilty about it, you know, that was really hard. I think that was one of the hardest things for me. It's just making yourself, it's okay to make yourself a priority again, now and again. It's okay.
Yeah, those are all great points. You know, I think it's, you know, when we talk about like self-care and wellness, people talk about it all the time. But, you know, as we've heard from Sue and Allison, Dr. Steinhoff, often, you know, you're just trying to figure out the basics for yourself, even, you know, not trying to get a massage or anything. So I guess, you know, Dr. Steinhoff touched base on this a little bit, but are there any sort of specific strategies that you would recommend, especially in hindsight? You know, I know in the thick of the moment, you guys were just trying to survive, but especially in hindsight, strategies that you would recommend for caregivers to try to take steps to care for themselves.
Yeah, I like to think about them as like micro moments, so like tiny things, right? And so we know that we don't have time to go to the spa and whatever that is. And so even like I got myself a water bottle that has like the hours of the day on it so that I like make sure, right? And so it's little things like that. I have a lot of coffee mugs that like say things because I know I'm going to drink that coffee in the morning. And so like I have a busy week. And so today I have like one day at a time coffee mug, right? It's like tiny little things. Like I got a little fountain for my home office, like I got a new plant, right? It's like, it's not the big things, but if you have enough of those little things built up, that can just sort of help you, a bit with some of those things. I think, again, I'll say therapy. And then I will also say that, like, I think, and I know this sounds like typical and cheesy, but I yoga, like, because it actually makes you stop and breathe. So it's the thing that everyone says you should do yoga, but they're kind of right. And so I found one where it's just like, it's not like a lot of, hard physical activity, but it just makes me like sit still and actually breathe, which is something that sometimes I get to the end of the day and realize I haven't done. So I think it's looking at the things you do every day anyway, drinking the coffee, filling up the water bottle, and then just trying to make those just a little sweeter to help yourself.
I think 2 years into Carl's treatment and he was on the clinical trial, I kind of am in more of a maintenance mode. I actually had to have very unexpected abdominal surgery. And one of their recommendations for me was, you got to walk, go daily walk. And it took this abdominal surgery to give myself permission that, hey, the doctor told me to walk, and that's a good thing. And it became, even though it was really quick, just down to the lake, it was a time that was my own, because I was losing myself, my identity. Everything was about Carl, that this little walk was for me, and that it was a time to take a breath and just to kind of gather up muster up, whatever courage or whatever you got, psych yourself up to go back and to be that caregiver again.
We have a question from the audience for Allison, or if anyone else wants to touch base on this. For anyone with kids, how did you really navigate things with your kids in terms of finding a balance between keeping them up to date, but also protecting them in some sense?
Yeah, absolutely. So our daughter now is 16. So she was 4 when my husband was diagnosed. And so we have sort of over the years kind of told her what was age appropriate, right? So she was 4 when he had a bone marrow transplant. And so at that point, it was more like dad's blood is sick and Uncle Adam's going to give him his blood and then it will make it better, whereas now that she's 16, we're just like, anything you want to know. But we also sort of will say like, so dad had a procedure today. How many details would you like? Would you like any details or no? Like we sort of give her the option instead of just like giving it. Cause sometimes she just is like, is he okay now? Yes, he is. Okay. That's all I need to know. Right. So it's definitely changed over the years. We've also sort of tried, I don't want her to feel like she has to be a caregiver. So we've tried to find ways to have her be involved. Like we have this picture of her when he was having his bone marrow transplant of her putting on the hospital socks on him, like helping in that way. Or when he first was like hooked up to IV nutrition, she thought it was cool that she could help. But for the most part, we want her to see him as dad, right? And to not feel like she has to take on that role. And also finding the balance of not just always feeling like we have to look like positive and everything's great in front of her, because then she's going to think that's how she has to act and how she has to feel. And so sometimes saying, this is terrible, we hate this, or we're tired, or we're scared, or whatever, enough so that she knows like we're in control and she is safe, but also to know that like this is a really hard situation and it's okay to have big feelings about it and it's okay to talk about it.
Yeah, that's good. So have you guys ever been told that by other people that you need to take care of yourself, or, or else you might get burnt out? And it'd be helpful to sort of touch base on, how does it feel to be told that by other people? And what would you wish that they offered or told you instead?
I think it's well-meaning, always take it in the spirit of what, which it is given. And I don't know that anybody could know unless they've gone through it, what it's like. And this is a unique patient population also, as we know, with a lot of unique needs. And I think, maybe something, because I've struggled with this too, in wanting to support people going through whatever it is they're going through. What do I say that doesn't sound trite or stupid or, perfunctory? And I think, maybe just saying, I'm really sorry you're going through this. Please know I'm here. I'm not quite sure what to offer you, but I'm here and I'm willing. So if you think of something that you need, please call me. I'll try my best. I think the honest part of it, trying to be honest about it, more so than sugar-coated or, use a trite kind of phrase, maybe that would be helpful from people, because I think a lot of times, I know from being on the other end of it too, we don't know what to say. We don't know what to do that would be helpful. We see a loved one, friend, family member going through this awful thing. And so we're not quite sure how we should step up. And it's really incredibly even harder when we see that they're terminal. How do you broach that? What do you say? How do you step up and be there for people that are dealing with, impending death? And I think just trying to teach, being honest about it. Yeah, this is horrible, but I'm here and I'm not going anywhere. And if there is something you think of you need, please, I'm here.
I think what I wanted to hear instead of you're going to be burnt out. Of course I know that, but I have no choice. I have to march on. Okay. But I was hoping they would say instead, it looks like you have a lot on your plate. Is there anything the team can do to help you? Okay. Like what I needed was I was juggling all these balls. I needed someone to give me practical, just help. Take some of these balls. That's what I need. That's what will help prevent my burnout. And I'll give you an example. We were so thankful that we were connected with the palliative care team when Carl started his second clinical trial, that TIL therapy. He was really dealing with pain management. And so for symptom management control, we were referred to palliative care, and they were phenomenal. Okay, if you want to talk about, that's what we needed, is they didn't question Carl's pain. I mean, it was shot up like in a matter of days. They never questioned. They were compassionate, and they would troubleshoot. How can we control Carl's pain better? Right. And I can't. And also, people don't talk about this, but opioid-induced constipation. It was excruciating for Carl. So I think having a team actually listen and then do something quickly, and they were so responsive to us. That's what I hope patients and caregivers can receive.
Yeah. I feel like when people say like, well, take care of yourself, I feel like they're like half seeing it, like they're seeing enough to realize like this is hard, but then they aren't. But what they're really doing by saying don't forget to take care of yourself is adding more to my to-do list. So they see that my list is long and they're adding to it, which feels hard. And I know that they're well-meaning. But I think some of the things that you two said about just the recognition of like, I imagine this is really hard. I'm here with you. But then I think the other thing is caregivers are notoriously bad at asking for help, even if someone says, let me know, right? And so I have found that some of those just really concrete, I'm going to be going to soccer practice, taking my kid to soccer practice next week anyway. I'd love to swing by and pick your kid up. I'm going to bring dinner next week. Would you like on Tuesday or Thursday? Right. So instead of having the caregiver have to like match make between like, okay, they're offering help. What do I need? Just saying, here are 3 options, or, like even things like, that people are always going to need things like toilet paper and paper towels and clean it, or, whatever. Just be like, I just put a delivery. It's on your doorstep. Right. So I think just even proactively doing some of those practical things, because caregivers are not very good at reaching out, even when people have said, let me know, just doing it.
Yeah, I think often caregivers feel quite isolated, and and then they're also told to practice self-care, which can be even more isolating in some sense. And so, did you guys experience any community care? And if you did, how was it helpful? And if you didn't, how would you wish like community care could look like for you or for a head and neck caregiver?
Yeah, there's actually an app I would love to tell you all about. It's a free app that's made for caregivers by caregivers. It's called IANA Care. So it's IANA, which stands for I Am Not Alone Care. And I can put it in the chat, but it was made for caregivers. And so it's sort of like Meal Train meets Lots of Helping Hands meets Caring Bridge all in one. And so we didn't have that in the beginning because it's a newer app. But once we found that, oh, thank you, Michelle. Once we found that, it was like a game changer, because then we could have a team of people. You can set people up. And so then we were able to say, invite specific people, but then also put it out on social media and whatever. And there were people who had said, I've been wanting to help your family and I didn't know how. And so now, even though I haven't used it in a while, like just knowing it's in my pocket is helpful, so that I know that like if we had a need tomorrow, I could say to my team, we need someone to give him a ride tomorrow, boop, and then the text would go out to everybody on my team. And so that's just been a really nice way to like let the community show up. I think the other thing is that I have found is the more we share about our story, the more our community is able to show up. And not everyone's comfortable sharing their story, and that's absolutely fine. But the more they know and the more transparent we are about what we're going through and how hard it is, the more people show up. If they don't know what's happening over here, they're less likely to make the offer or bring the casserole or whatever. So, but again, so you have to sort of balance what you want to share with how much help you're interested in.
I didn't really experience communicare anything so I don't know quite how to address that. I think, I could have been better, should have been better about knowing. I didn't really know what to ask for, I didn't really know what I needed. I just knew I was exhausted and sometimes angry and sometimes really frustrated and feeling very guilty about those emotions. And I thought, well, maybe talking to a therapist is a good idea. Just to have a neutral ground where I can rant and rave and not feel guilty about it. So I guess I didn't really know what I needed at the time. Like Sue was saying, I think in hindsight's kind of 2020 about, having, before you go into this, I mean, first of all, you're blindsided and you need to get into the fray pretty quickly. So it's kind of hard to plan for what's unexpected. But having a support thing, I just kind of wish I'd had somebody to come in and clean or, just go take a nap. I'll clean the kitchen or whatever it is. And luckily we had good family and friends support where people would come because we were off site. We weren't near our home. So I didn't know anybody. So we'd have people come, to see us and stay. And luckily we had accommodations where they could have their own bedroom and, bathroom. But I insisted on bringing at the time, 3 dogs also. So who were wonderful. They were probably easier to care for than any of the humans, that's for sure. But just people coming to visit and saying, I'm going to come over the weekend. What do you need? So I kind of wish that I had thought a little bit more at the time, but you're in battle mode and you're just trying to survive. So, hindsight again is 2020, but those kind of support things, the little things, that have been mentioned, just stupid things like, I don't have the energy to go pick up 4 prescriptions and clean and go to the store and, X, Y, and Z. And we're dealing with another side effect that's probably going to end us up in the ER tonight. I can deal with the ER tonight. If you can deal with X, Y, and Z, that would be so helpful. And so I really had to learn the hard way to ask.
I know we're short on time, but I would just again echo my panelists, Allison and Andi, that it was practical things that people did. Like, I am working. Can someone please help drive Carl to radiation every day? Or just, yeah, practical things. But I do agree with Allison that at times there's so much on your mind as a caregiver that someone's saying, well, can I help you with something? I don't have the mind space to come up with X, Y, and Z for you. And I think that's how exhausted at times being a caregiver is like, that you don't know what kind of help you need because you just don't have the energy.
Yeah.
We're sort of getting towards the end of our session. If you could all say just one thing to the caregivers who are listening today, what would it be?
I'd say thank you. Because I could be, I think about, I could be in that situation of needing caregiving, and I thank you. So thank yourselves as caregivers. And thank you for all that you do. I think that's what I would say. It's really hard to describe what it is that you do and everything that you do. But, just my mom will say to me, even today, she'll say, I don't know what I would do if you weren't there. I don't know what I would have done. And I don't feel like still to this day that I did anything, honestly. I really don't. But we're here for each other. That's what it's about, being human. So I just would say thank you.
Yeah, I would say caregivers, you're a part of the story too. So there's this big story that's happening, and it's okay to acknowledge that all the things that are happening have impacted you and your life and continue to, and to claim this title and to reach out for support because you are loved and deserving of support, and all the ways that this has touched your life as well.
And I would say to the caregivers out there, your story and journey is uniquely yours to tell, or not tell, but it's yours. But know that there are so many caregivers out there that could relate to your experience. And lean into this community. You're not alone. You are just not alone. Okay.
Our panelists have graciously compiled a set of resources for everyone, and so we'll show the slides right now, but also have them available later on. And so I would just like to really thank all our caregiver panelists, Allison, Sue, Dr. Steinhoff, for serving on this panel and just graciously providing their insights and helpful tips and experiences to really help our other caregivers. I want to put out a special thanks to the Head and Neck Cancer Alliance and the American Head and Neck Society for their time in organizing and hosting this How to Care for Yourself and Your Loved One with Head and Neck Cancer webinar. But just really, again, I really want to thank our panelists for sharing such sort of personal and helpful strategies for all the caregivers out there.
Thank you for the opportunity and thanks for highlighting caregivers.
Thank you.
Thanks.